Well, Dan, this year's influenza season has begun, but of course it's also taking place during the second year of the COVID-19 pandemic. That raises some questions for people who might be seeking out ways to keep healthy. Fortunately, there's now a safe and effective vaccine for both of these diseases, but the State Department of Health does say that childhood flu vaccinations are down this year about 25% compared with 2020. To talk about flu vaccines, COVID vaccines, and all the things you need to know, we've invited Simon Mendoza, certified physician assistant from Columbia Valley Community Health. Simon, thanks for being here.
Thank you. It's a pleasure to be here. Thanks for inviting me.
I know you're coming in on your day off, so we really do appreciate that.
My pleasure. Thank you.
How long have you been working at Columbia Valley Community Health?
I just had my 5-year anniversary with CVCH. So I've been a PA, family practice PA there for 3 years, and I recently transitioned to our outreach department. So we've been going around different smaller communities and bringing our mobile trailer there to provide greater access to healthcare.
And your job as a certified physician assistant involves seeing patients like an MD would?
Yep, I have scheduled patients. I can perform minor procedures in the office and prescribe medications. Yeah.
What do you tell your patients or people that you might be seeing on a regular basis about flu vaccination? It's the season to get it. The vaccinations are available. What's your advice?
My advice is absolutely to get it. It's the best protection that we can provide ourselves and our children. And even though there's been a decrease in cases with the social distancing, masking that we've been doing since March 2020, there is reduced population immunity, so that increases possibility of having a more severe and early influenza outbreak.
How did we reduce our population immunity? What happened in the past year or so that made us less or more susceptible to flu?
So masking, social distancing, staying at home, all of those measures reduce the transmission of respiratory droplets, which is how influenza and COVID-19 are transmitted. Influenza is less transmissible and less contagious than COVID-19, but it's still a risk.
But the steps we've been taking with regard to COVID-19 have proved to be protective across a couple of different possible illnesses.
Exactly.
With that in mind, if we are still in a period where we're maintaining distancing and masking and so forth, is the flu vaccine still a crucial thing in the fight against flu?
Absolutely. I mean, even though most of us are following all those guidelines, we're still indoors the majority of the time, especially in the winter time and around the holidays, and respiratory droplets are transmitted much easier and readily indoors and can travel greater distances. So anytime we're indoors with a group of people, your risk increases significantly of contracting COVID-19 or the flu.
One of the critiques of some of our COVID-19 pandemic protections has been, well, it's an overreaction, it's no worse than the flu. Leaving that aside, the severity of COVID-19 compared to flu, what is the severity of flu? What kind of risks do we run when we contract it?
So it ranges, but we do see several hundred to thousands of deaths per year from the flu, and it primarily causes more severe illness in children and older adults or those that are immunocompromised.
Is it safe to get a flu shot and a COVID shot in one sitting?
Absolutely, and I usually recommend that people get both. Just get one and done, or two and done.
And one can't protect from the other. You can't get cross protection from COVID by getting your flu shot.
Exactly, they're completely different vaccines.
If somebody's experiencing symptoms, and the symptoms of these two ailments can be very similar, is there a way that I as a patient can distinguish, well, this feels like the flu, or well, this feels like COVID? Is there a way for me to be certain or sure without getting a test?
I really wouldn't recommend that people try to distinguish the two because it's hard enough for healthcare providers to try to distinguish it. One of the symptoms that is common of COVID-19 that we don't really see of the flu is the loss of taste or smell. But I wouldn't rely on that alone, and I do recommend that people get tested. We are frequently testing people for both. I know the CDC is as well, just to get that surveillance data.
Is it possible to contract both diseases at the same time?
Yes, we have seen that among hospitalized patients. So obviously having two different viruses can overwhelm our immune system and cause more severe illness.
And we talked about the decline in the sense of taste or the sense of smell if someone is COVID positive, but that's not always a symptom of COVID, is that right?
Right, exactly. And that's why I don't recommend relying on one symptom or another to distinguish it or rule it out.
It seems to create a range of symptoms, and people can fall somewhere within that range.
Absolutely. We've seen GI symptoms, diarrhea, abdominal pain, and the upper respiratory symptoms. Shortness of breath is usually more common with COVID-19, but we do see it in the flu as well.
And all of these symptoms are still things that could be mistaken for flu without a test.
Exactly. Yep.
What concerns, when patients come to you asking about the flu vaccine, what concerns are they expressing about whether they should get it? Are they expressing concerns for their own health or for their children's health?
So the most common misconception that I hear is, I got the flu vaccine last year or whenever, and then I got the flu. That's not possible because these flu shots are inactivated or weakened forms of the virus. The other concern is that getting both of them together might overwhelm the immune system. But in an otherwise healthy person, our immune system can deal with getting the two immunizations. And like I said, we actually recommend getting the two to get the best protection.
A lot of people report second day, not complications, but feelings like lethargy, maybe a headache, I'm tired, I need to drink a lot of fluids after their COVID vaccine. You don't hear too many contraindications for the flu vaccine. Most people seem to go through their day pretty well after they get one.
Yeah, we have seen more moderate symptoms with the COVID-19 immunization, but I always think of that as a good sign because it means our immune system is ramping up. We're producing protective antibodies, neutralizing antibodies. So when I had chills, the night of my vaccine, I considered it a good thing.
And one thing about the Pfizer vaccine, which is the one that's approved for ages 5 and up now, is it doesn't involve any viral material at all. It
Right.
creates that immune response without introduction of inactive virus into the body.
Exactly. What we introduce is mRNA, messenger RNA, which is basically like a recipe for the spike protein of the virus. And then our bodies start to produce protection against that spike protein so that if we come in contact with the virus, which contains the spike protein, we'll be able to neutralize it and control it.
Simon, can you think of anything else that you'd like people to know about the need for a flu shot in this 2021 season, which is unlike other seasons, again, because of the presence of the COVID-19 virus?
Right. I would just say, don't take a risk, get the flu shot. It's hard to know if our numbers are going to continue to be low or if we can have a severe and early outbreak. So I would say don't gamble it and get vaccinated.
Now, there are lots of opportunities out there for people to go to a drive-through and get their COVID shot. Where can people get a flu shot easily?
Yeah, so Columbia Valley Community Health, we're holding community vaccination clinics. We recently partnered with Cafe. We've been partnering with them to do Saturday flu shot clinics. You can, of course, come to our different locations in WENATCHEE, Chelan, and East WENATCHEE and get vaccinated. In most cases, the flu shot is free, so that shouldn't be a barrier to getting it.
Lots of opportunities out there.
Lots of opportunities, yeah.
Simon Mendoza with Columbia Valley Community Health. Thanks a lot for joining us today.
Thank you, my pleasure.
You're watching the NCWLIFE channel.